I'm going to hit record. Great. So I'm going to talk about the background with the two pieces. As Tony K, I believe, said, for the longest time, it's actually our longest running IAPOH work group. We had what was called the Childhood Nutrition and Physical Activity in Educational Settings work group. So with IAPOH, we had work groups. We had many work groups at one time up until our founding through 2018. And then we ended up making decisions to streamline and turn many of those groups into a single campaign issues or a short-term length initiative. But the one that persisted for the entire length, over 13 years, was our childhood one, as we call it for short, focused on school health. Now, the long-serving co-chair of that group, Sandy Newell, who is a physical education teacher, was not able to join us today, but she is to this day the work group co-chair. And so the focus of that group was school health. And we'll talk more about the ECE part in a second, which kind of manifested in different ways in our coalition, not a specific work group for some time at least. But when it came to school health, although the focus of the group was physical activity and nutrition, typically through its history, it was strongly focused on physical education. In fact, I don't see many, I see a couple of our core partners from the work group, but some from the physical education side I'm not seeing here, and we may see them in the second round, but very physical education focused. So you can see on the screen that particularly from about 2015 to 2018, there was a strong focus on statewide work around improving the quality and availability of physical education in our state. So some of those initiatives had to do with revising our state learning standards on physical development and health. So our coalition was advocating for different laws on how to strengthen physical education. And so some of that advocacy led to the state establishing a task force, and the task force revised the state learning standards, which had not been revised in over a decade, really integrating some concepts around enhanced physical education, which has to do with maximizing the amount of physical activity and the intensity of physical activity that's offered in school-based physical education, or PE, as I'll refer to it going forward. If children get enough physical activity and at the right intensity, their brains, there's a growing body of neuroscience research that shows that the brain is more primed for learning, that there are improvements in outcomes relating to performance in school, relating to health, of course, relating to social development as well. So because there is that research base, our state decided to promote enhanced physical education, which is an evidence-based best practice recommended by the Centers for Disease Control and Prevention. So we revised our state learning standards to integrate those EPE, enhanced physical education concepts. There was a law around requiring fitness testing for all the students in the state. That's been suspended since the pandemic, but it did start in 2018. The number of days in PE were added to the school health report card, and ongoing advocacy around, for a while it was, for a long time it was daily PE, and then it went to minutes and days per week. So most recently, aside from the physical education work, we've been focused on the Healthy School Meals for All bill, and which is now a law. So this is a more recent initiative, but it was around wanting to ensure that there were free school meals for any student in this state who needed or wanted one. So there are many kind of administrative and financial challenges that prevent schools from being able to offer free meals for all, free breakfast and free lunch. So there's a lot that I could go into, but basically, as of this year, a law has been passed that establishes the framework for schools to be able to do this, to get around some of those fiscal and administrative challenges that have been preventing them from doing this, from maximizing available state and federal funds to do this. However, the law was not funded. And so the next step for our coalition, because getting that framework in place to be able to utilize that to offer the free meals is a huge step. But we now have to get the law funded. So if you're interested in being a part of that ongoing conversation, please let me know because that's what we're working on now. So on the ECE side, the main way we've been doing our early care and education work is through what's called the Illinois State Physical Activity and Nutrition Program, the ISPAN program. It works through 4 strategies to improve physical activity and nutrition, basically in the state. So one of them is ECE. And we've been working, and INCRA with Beth Knight has been one of our main partners on this. But we've been working at the state level to improve professional development offerings and trainings for providers. We have established a statewide technical assistance network that a couple of folks here are part of today to work with centers and homes on assessing and moving toward practice improvement around physical activity and nutrition best practices. We've been doing work around the child and adult care food program. A goal is to increase uptake and retention in that program. And we're also working on updating our quality standards here in the state for those programs that are trying to reach silver and gold level status in quality care. So we had a strategy work group, and that work group, and some of you on this call here today were part of that, helped select our strategies, develop our learning sessions and focus groups to inform our strategies and how our work is moving forward, and making those connections to local experiences and expertise. So I'm happy to tell you that we have just been funded for another round of SPAN. So we're going to have another 5 years of this programming. It's not going to look completely the same as it did, but ECE is still a priority area. And we really want to, our plan is to leverage what we've built. So leverage some of that statewide TA infrastructure. We are anticipating some changes to licensing standards for family and groups homes that will give us an opportunity to work further with providers on best practice implementation. We want to continue our work on CACFP, increasing awareness and access. And we're going to have some particular work around strengthening farm to ECE and local food purchasing at childcare sites. So that's a really high level snapshot. I know time is running short, so I just want to point out from our framework that when it comes to ECE, supporting the workforce is a priority, especially emerging the ECE workforce from the pandemic and knowing the challenges that centers and homes have faced in keeping their doors open, let alone working on practice improvement, working on CACFP utilization, and coordinating connections to health-related resources, partners and agencies, and connecting those available resources to providers. And when it comes to school, it's improving the connection between schools and districts to a broad set of health and wellness resources, because we know there are many available resources. We want to increase that connectivity for districts. Enhancing the partnerships with the State Board of Education and school administrative associations to promote the whole child health model, and promoting a framework of training and technical assistance to help move parents, teachers, and staff forward in wellness policy development and implementation. So with that, I would just love to open it up. I've said a lot, but to hear more about what you are excited about talking about first on both the ECE and health sides, which we're now merging. You can type it in the chat, or just I'd love also to just unmute and share what you heard that excites you and you think is most important to discuss first.
So this isn't necessarily our realm within Bertha 5, but I think just in general, having the school meals for all is amazing. I love that you guys have that framework in place already. I didn't know about that. And then, yeah, just advocating for that funding, because I think our school was able to provide that last year for kiddos, and I think it made a big difference for families. And as we see food prices increase and everything, it's going to be important. And then also, yeah, that ECE workforce is what we're interested in. So,
yeah, great. I'm glad to hear it. And I can add you to that healthy school meals list for that ongoing discussion if you're
Yeah, that would
interested.
be amazing.
And I know time is running short, so I'd love to hear if others had things that stood out to them about what you're excited about.
This is Allie Lofotis. One thing that we're noticing that's coming up in programs is immunization rates are going down. So, and also programs having trouble having families get connected to a primary care physician, a pediatrician. They might call and the staff just no one picks up. I think it's not, throwing the pediatric field under the bus. They're very understaffed as well, but it's really hard to get in to see a provider and then get appointments. So those are big issues. And then I was really excited to see a focus on mental health. And because I work a lot in social emotional mental health and kids getting kicked out of.
Hi, Deanna.
Hi there.
How are you today? I'm glad you could join. I'm going to see if we
Yeah,
get anyone else. Just put me and you.
I'm feeling a little nervous all of a sudden.
Well, and if you want to, if it ends up being me and you, we could share about this. And, if you want to jump around too, that's fine.
Sure,
But I
sure.
know, right? All eyes on you. We had a large group last time, so it's interesting to see.
Yeah, exactly.
Mhm. Okay.
We'll see who we get.
Yeah, we'll see.
Well, do you mind if I grab this really quickly? It's our
Oh, yeah.
finance person
Go
and I'm
ahead.
trying to
Yes,
move
of
something
course.
through.
Of course. Yeah.